Welcome to our informative video on how knee issues such as arthritis, meniscus tears, cartilage damage and instability can lead to or aggravate various hip conditions. Knee arthritis and hip osteoarthritis. Knee arthritis is characterized by the inflammation and degeneration of the knee joint cartilage. This condition often leads to altered gait patterns as individuals attempt to minimize pain. This altered gait increases the load on the hip joint, accelerating wear and tear and leading to hip osteoarthritis. Symptoms include hip pain, stiffness, and difficulty walking. Meniscus tears and hip bursitis. Meniscus tears are common knee injuries that affect the cartilage cushioning the knee joint. These tears can cause pain, swelling, and reduce knee function. To compensate for knee instability, the hip joint often works harder, leading to inflammation of the bursae around the hip. This condition, known as hip bursitis, causes pain on the outside of the hip, tenderness, and swelling. Cartilage damage and hip tendinitis. Cartilage damage in the knee results from injury or degenerative conditions like osteoarthritis. This damage increases friction and pain during movement. The body shifts the load to the hip to avoid knee pain, causing overuse and strain of the hip tendons. This can lead to hip tendinitis, characterized by pain and tenderness in the hip or groin, especially during movement. Knee instability and greater trochanteric pain syndrome, GTPS. Knee instability, often due to ligament injuries or muscle weakness, forces the hip to work harder to stabilize the body. This can lead to greater trochanteric pain syndrome, where the tendons and muscles around the greater trochanter become strained and inflamed, causing lateral hip pain and tenderness. Knee issues and iliotibial band syndrome, ITBS. The iliotibial band can become tight and inflamed due to compensatory movements from knee pain. This leads to iliotibial band syndrome, causing pain on the outside of the hip and knee, especially during activities like running or cycling. Knee problems and hip labral tears. Chronic altered gait and increased stress on the hip joint from knee issues can lead to tears in the hip labrum. Hip labral tears result in deep hip pain, clicking or locking sensations, and limited range of motion, often requiring surgical intervention. Knee instability and secondary hip muscle strain. Knee instability leads to compensatory overuse of hip muscles as they work to stabilize the body. This overuse can result in secondary hip muscle strain, causing pain and tenderness in the hip muscles and muscle weakness. Managing knee and hip health. Managing knee and hip health involves medical treatment, physical therapy, and lifestyle changes. Strengthening exercises, proper footwear, and weight management can help alleviate stress on both joints. Consulting with healthcare providers for a comprehensive treatment plan is essential for preventing and managing these interconnected joint issues. Thank you for watching. If you or a loved one is experiencing knee or hip pain, reach out to your healthcare provider for support and guidance. Early intervention can make a significant difference in your joint health. Stay informed and stay healthy. For more information, visit our KDVMA website or download the Vets Portal app.